Hi, my name is Diya Prasanna, and today I'm going to be speaking about the impact of music therapy as a non-pharmacological method of treatment for schizophrenia. I am a rising senior at Dublin High School in Dublin, California. My interest in neuroscience began when I worked alongside Dr. Rohn from Boise State to research sexual dimorphism in the neurons of male and female rats. Additionally, I participated in Dr. Akbari's lab at UC Irvine focusing on neurological outcomes after cardiac arrest and resuscitation. I have also been training in classical music since I was little. Today, I'm going to speak about a topic that ties my passions of neuroscience and music together. I started my research in 2024 in UC Irvine under my advisor Peyton about the impact of music therapy in schizophrenia. First, let's start off with an overview of schizophrenia. Schizophrenia is a neurodegenerative genetic disorder. It is caused by a change in neurotransmitter levels in other aspects of the brain. The disorder follows a diathesis stress model. This essentially means that it is activated by an environmental stressor, such as substance abuse, infections, or living situation. Schizophrenia is also one of the leading disorders worldwide, affecting about 24 million people. It can also lead to a multitude of other disorders, for example, depression, substance abuse, and suicidal thoughts. While there are various effective treatments to mitigate schizophrenia symptoms to allow patients to live independently, there is no definitive cure, making it extremely important to study it more. Before we dive deeper, let me tell you about the symptoms of schizophrenia. Schizophrenia has two types of symptom, positive and negative. Positive symptoms are characterized by the addition to existing behaviors, such as hallucinations, delusions, and disorganized speech. On the other hand, negative symptoms are characterized by the loss of existing behaviors, like reduced speech, a lack of motivation, or a lack of emotion. Currently, positive symptoms of schizophrenia are being treated with antipsychotic drugs and antidepressants. But the focus for today's presentation is how the negative symptoms are being treated. Negative symptoms of schizophrenia must be treated in a different way than the positive, with interpersonal interaction. Today, negative symptoms are being treated with psychosocial therapies. However, these therapies do not show consistent improvement among patients and do not fully address the symptoms. Music therapy is known to be an effective therapy to manage stress and promote wellness according to the National Institute of Health, which could make it effective in treating the negative symptoms of schizophrenia as well. In this presentation, I will be exploring research about this topic. I will also be talking about the application of music therapy in schizophrenia treatment, how effective it can be, as well as why more research must be conducted on this topic. Musical therapy uses many different aspects of music, such as harmony, beat, and melody, to improve information processing and the well-being of the patient. Research shows that musical intervention causes change in neuroplasticity and activates the frontal, parietal, and temporal lobes as well as the cerebellum in the brain. The network of these brain regions processes external stimuli for organization, memory, and more. Because music activates all of these areas at once, it has been researched to be useful as a treatment method. Music therapy has also long been used to help treat many different neurological disorders. Neuroimaging results also display a correlation between music and brain circuitry. Musical stimuli increases brain activity in areas related to emotions and feelings. Music also causes change to neurotransmitters. Studies have shown greater neuroplasticity in musicians and people who regularly listen to music, which could be you. Neuroimaging research and EEG data suggests that music is processed differently in the brain depending on the emotion it evokes. Music that evokes tenderness activates the right striatum, while music that evokes happiness triggers the left striatum. The anterior cingulate cortex and insula involved in creating emotions are activated by pleasant music. The hippocampus, which helps form memories, also becomes more active with pleasant music and can impact bodily regulation. These brain responses are important in schizophrenia, where emotional and bodily regulation are often disrupted. A study investigating the effects of music and visual art therapy on patients with schizophrenia utilized gamma and theta oscillations. Gamma and theta oscillations are rhythmic electrical activities in the brain. The study was conducted over a 5-week period and revealed significant improvements in both groups. The music therapy group participated twice weekly, 45-minute sessions. They focused on emotional expression through singing, songwriting, and listening. By doing so, this group displayed a greater reduction in symptoms compared to the visual art group. This study results specifically show that music therapy was more effective than visual art therapy in alleviating negative schizophrenia symptoms. Music is a versatile art form that is shown in research to reveal memories and emotions by influencing our physiology and behavior. Music therapy is becoming established as a profession. The fact is, many accredited programs offer bachelor's degrees for it as well. Based on the current state of research discussed today, music therapy is showing promise as a treatment option for schizophrenia. Those diagnosed do not necessarily depend on verbal expression. This makes music therapy a different, sometimes better outlet for communication. Music research, however, is more about the negative symptoms, and drugs may still be needed to treat the positive symptoms. But the promise here is that the combination with music therapy can produce a significant outcome for these patients. Given that schizophrenia is a leading disorder worldwide and there is no cure, the promise of music therapy makes it crucial for doing more research in this area. In order to conduct more research, randomized control trials with larger sample sizes are needed for better statistical results. Future studies should use control groups to mitigate confounding variables and focus on the specific ways that music therapy impacts symptoms of schizophrenia. Additionally, research examining various effects of symptoms and treatments will be helpful to further findings. All of the positive impacts of music therapy that I discussed today can be credited to the research cited here. I would like to thank my family, UC Irvine, all of the researchers on the topic of music therapy and schizophrenia so far, and the Global Health Leaders Conference for making my presentation today possible. Thank you for listening, and I hope you gained insightful information about the treatment of schizophrenia and the importance for further research on music therapy as a viable treatment option. If you're interested in learning more, my email is here. Again, thank you so much for your time.